Or like Megan Gilster's class in the School of Social Work.
Yeah, we know her. Yeah.
Okay.
I'm sure a lot of people from that class like
Yeah, just put it in the middle. It should be going.
I'll tip it up a little bit so I can actually see you guys. How about that?
Yeah.
It might be a little crooked.
That's okay.
Okay, what do I need to push?
I think it's going.
Oh.
There you go. That'll work.
So then we will hand out today.
All right. So yeah, this is just like tangible information. We figured that this would be a good and effective way for you guys to just like look at this information that we're basically going to be giving to you verbally, but just when we're not here.
Yeah. Okay, so basically we were tasked with creating a policy brief. So we were supposed to look at an issue in the area related to poverty and homelessness and kind of propose some type of solution and then go out and present it and just propose a new idea. I know peer recovery coaching isn't like a super new idea, and you guys are kind of doing something similar, and you have the Fairweather Lodge, and but this is just kind of like a very like unique approach to it. So yes,
And more specifically, the model that we're talking about is like one that Caitlin has experience with.
Yep.
So she has, like that first live, like really liked how this was implemented, really liked how this training went, how they did everything. So that's why not only do we want to talk about peer recovery coaching in general and why it's a really cool evidence-based practice, but also specifically the CART model and how we think that would be a really cool implementation. But yeah.
Cool. So first we've been doing a bunch of like research about like national statistics and like some more local ones, and just kind of seeing I think like overall we found that substance use is one of like the major things that holds people back from like achieving long-term like stable housing, and so we kind of just like dove in with that. And just looking at a lot of information about just like the prevalence of substance use with the homeless population. And so that's kind of like what we have a lot on the first page, and Alexis will go through some of that.
Okay, so the issue that we're talking about is the prevalence of substance abuse within the homeless population. In 2008, substance abuse was the single largest cause of homelessness for single adults. Substance abuse is one of the top 3 causes of homelessness for families. In 2007, 2/3 of homeless people report that drugs and/or alcohol was a major reason for their becoming homeless. For the general population, alcohol problems range from 12% to 68%, and estimates of other drug problems range from 1% to 48%. Alcohol abuse may be the single greatest risk factor for arrest among the homeless population. Histories of arrest and incarceration indicate that homeless alcohol-dependent people are 2 times as likely to have criminal histories as those who are not alcoholics. And drug abuse and dependence were 6 to 7 times greater in homeless adults, and 10% of homeless people have current drug use and drug dependence issues.
So then we kind of go into like what is peer recovery coaching. And it's basically a form of peer support that involves the process of giving non-clinical assistance to support long-term recovery from substance use disorders. And the thing that's like unique about it is it's like the idea that it's non-clinical, and a lot of the time people who are being coaches have like lived experience, and so they kind of can relate to people and they can help the recoveries walk through their recovery, and the major point is that they're not here to like really give that much advice or like have a huge say. They're just kind of here to walk with that person and help them like get access to certain services, and not really like taking on any of their successes or failures. Just kind of like, if they like, let's say someone's been sober and they come to their coach and they're like someone just called me and I want to go out drinking, and the coach will just be kind of like have you considered your options, like what's going to be the outcome of that, and just kind of someone who's there for them during that process.
Right. That's kind of like one of the strengths of peer recovery coaching. Excuse me, specifically in the CART model, because it's that non-clinical setting. It's very much so like more of like a friend in a sense that's trained on, you know, like different ways of how to navigate, you know, recovering from substance abuse. So it's not someone who has a fancy degree per se in this kind of recovery, but it's someone that's trained in basically being an advocate for that person and being there in a non-judgmental manner. And it is mentioned that usually it's someone who has lived experience, as Caitlin mentioned, but with the CART model, it doesn't even necessarily have to be someone who has a history of mental illness or substance abuse. It can be someone who's, you know, already an advocate for this community. It could be a volunteer here who has already dedicated like 2 years of service to working with this population.
The people who are kind of already showing up, already kind of passionate about it, and just kind of going around and reaching out and like expanding the network of people. Like, you're already helping, you could help in this way as well. Just kind of expanding their like toolkit of resources. And so just kind of like what they do, we kind of went through that already, but like they share their experiences and they're just kind of there to walk with that person in their recovery. And then the big question, like, is it effective? Is peer recovery like support, like as a model, is it effective? And like with a lot of the research we found, it's very effective. And like we said, it's an evidence-based practice. Many people who went through this experienced improved relationships with treatment providers, improved access to social supports, and greater housing stability. It's also a lot more affordable because it's not like a clinical, like you don't need like a degree to do it, and it's a lot more accessible, I would say. And we've seen higher rates of, we found a lot of information about higher rates of, or like longer rates of sobriety and like lower rates of relapse. But it's also a cool model because it recognizes different pathways to recovery. It's like recognizing that relapse is a part of recovery as well. So I think that's something that's significant. So yes, I think.
The strengths, as we've already mentioned a couple times, it is non-clinical. So, or focuses on non-clinical issues such as like housing, kind of navigating the legal system, employment. So those are all things that a peer recovery coach can kind of just like hash out with that person. And it's kind of, again, like this peer recovery coach is just someone to lean on, and they have the resources that person can utilize when kind of figuring out those different systems, and like, which are all, as you may know, are all part of the cycle of recovery. You know, there are different various systems that people need to navigate. But yeah, peer recovery coaches engage with those who are also waiting to get into like professional help as well, which is something that I think wasn't even like a main focus for like peer recovery coaching when it was first like started. But they've realized that a lot of people that are waiting to get that professional clinical help, sometimes you can't get in with someone right away, or there's financial issues. So this is a really cool resource for people who just like really need someone to talk things through with, but just don't have, like, they just can't get with someone, with a professional at the moment. So that's a really big strength of the CART model and peer recovery coaching oftentimes. But yeah, this is an evidence-based practice, which is, I know, very important to like organizations like Cross Park Place, or basically every social service agency. You need to be implementing evidence-based practices, or at least practices that have a lot of data to show that this is working in other programs.
So yeah, we've been talking a lot about like CART model, and so I'm sure you're wondering what that means. So CART is Center for Addiction Recovery Training, and they're home of the CAR Recovery Coach Academy. And in March, I attended one of their sessions and became a certified recovery coach. And so I just got like super excited about that, and now I'm really passionate about it. And I was like, where can we bring that back and start getting people involved, because they really encouraged us to kind of like reach out and like, well, now what are you going to do with your training? And I think this, like, I just think a lot of what they teach and like just the whole model really fits well with like the like model you guys have here at Crossbar Place, like the not like it's unconditional, it's affordable, it's like not harm, it's like harm reduction method,
And it's sustainable because once you are trained as a peer recovery coach, then you can also take like additional training to train other people to be coaches.
Right. And so that's what I did as well. I did like training of trainers, so that I could also like train a group of people. And so that's kind of that's kind of like what this is talking about, and what we think could really work well here is potentially like hosting a training at this location, or somewhere around, but getting a group of people kind of trained with this model, and then having them be resources for the people here. So I'm going to just talk about like the cost of this. So curriculum is delivered in 2 parts, as an in-person 3-day training which is worth 18 contact hours, and an online 2-day training which is worth 12 contact hours. The trainer is responsible for the training materials for each person. So this means that like if I were to host a training, I would need to provide all the materials, and how I do that, like how I fund that, either I personally fund that, or I can ask around in the community say, hey, we're doing this might like impact you in this way, would you be willing to like sponsor one person? Or the way I didn't have to pay for my training because it was sponsored, or it was through a grant through the Iowa Department of Public Health, and so there's also like resources there that can be tapped into that will like pay for this kind of training. But it is a $30 fee for the training booklet and a $70 fee to access the online portion. And then I was just like browsing around on their website, like some of their trainings are listed as like $800, and I was like, what? And so then I reached out to the lady who did our training, and she was like, that's all additional costs. So that's if you have to pay rent for a location, if you're paying your trainer, like if you're compensating them, if you're getting like food and lodging for the people attending, things like that, where that's just a lot of extra stuff, and like the bare minimum, and like the content and the training material is amazing, and I don't think it needs a lot of extra things. And I think if you guys were to host something here, there's no like really fee for the location, and you can find trainers who will voluntarily lead it, and then it's just like finding how are we going to pay for the training materials. So then I just also up here at the bottom, like how do you actually go about implementing this? And I have I brought this is like from my training. So this is like the booklet, and it's just like it just goes through day by day. There's a schedule every day. It tells you kind of like what you're going to be covering, and then there's just all these different like activities. And I put in there one of the things that's important about like doing something like this is the group of people you have. So we kind of talked about reaching out. Like originally we were thinking we need people who like have conquered homelessness, who have like been sober for all these years, like have this like amazing lived experience, and then they can help these people. But I met with the peer recovery coach who works at Prelude, because he also attended the training, and he was like, you really don't need that. You need the people who are already showing up, the volunteers who are working at Shelter House, people who are involved with 12-step groups already, and like people who care about this, and just reaching out and expanding that. And so we talked about the group size, because in my training we had about 16 people, and that was like the perfect amount, because there was in their program they do a lot of like one-on-one work, they do small group work, and then large group work. And so we were talking about like if that were to be implemented here, like 16 is kind of a good number. And then this is just kind of talking about like how you go about requesting the information. And so this is like ordering, like who's the trainer, who's sponsoring like the training, and just like talking about ordering materials. So first one, let's look at that. And then this is the information that I got like to train. And so it's a really interesting program. They've like designed it, they've reworked it about 1 million times, and it's amazing now. It's literally just a script. Like when after we finished the training, and this training was after we did our like
Initial
training, and we were all laughing because it's actually just a script, but everything they have in here is like amazing, and yeah, I just really love it. But I think overall, we just think it would fit in really well here. After trainers complete their training, they are certified recovery coaches, and they have a choice if they want to. They can work for an agency or like a treatment facility. So like my friend Faraji, he is employed at Prelude as the peer recovery coach there. But a lot of people, they can do it just like teaching piano lessons. Like you can offer those services, and it's up to you, like the individual coach, if they want to charge or not. And so what we're proposing is that if a training were to be held here, that group of newly certified coaches you could offer them like to sign in some sort of volunteer agreement saying, we've kind of like provided this for you. We would love it if you like volunteered your time to come and be recovery coaches here at Cross Park or out in the community, that kind of thing. And that's how we think it would fit in really well here.
But yeah, we basically, like, the reasons why we think this would be so well implemented is based on like the evidence that we've seen on the CART website and other very similar programs that have implemented it, and how it has affected their surrounding community as well. So I think that that's one thing that's one angle that I like to look at, like how it really impacts the community as a whole, not just like the Cross Park community. But, you know, obviously when there's improved or decreased substance use, that's like decreased criminal involvement, that's like less people getting readmitted to the hospital rooms, less emergency costs. So
those acute services.
Yeah, the use of those acute services, which, you know, they indirectly kind of impact the community as a whole. And as you guys know, implementing like something like Cross Park Place is in the long term going to save everyone kind of a lot of money. So in that sense, like from a macro perspective, like this is a really cool program because it does impact people significantly at that direct level individually, but then also how it impacts the surrounding community is really cool as well. But yeah, so that's our whole gist. This is just physical, again, tangible information that you guys can take, look at, and then so then you know where you can look if you want to look it up online as well. But we would love to open it up to any questions that you guys have.
I was just curious, what is this, like what we've presented, like how is it similar or different to like what you guys kind of have?
So I guess I do have a question. So is a peer recovery coach able, didn't read all your bullet points, but I think it's on there, maybe it says, so peer recovery coach versus a peer support specialist,
they're used interchangeably.
Okay. So it's reimbursable, it's a Medicaid reimbursable service as well.
Yes, it can be, and it's covered. That is a service that's covered in Iowa. It's in like 36 states, and Iowa is one of them, I think.
And so this training through CART would do the same as the peer support specialist training that I think like the Department of Human Service puts on as well.
Yeah, I believe. Yep. And this was CCAR. So it was founded in Connecticut, and so like that's why there's another C. But they have like spread it all over the place. Like the lady who came and did our training was from New Jersey, and she was great.
Yeah. So I'm a big peer support coach, specialist, whatever word you want to use, advocate. I think that they are, it is where things are moving. It's already been, as far as the supports that the individuals who were serving within this agency, but also across, kind of the population. Definitely, I'm a big fan of it. I think that we have a lot of, the Fair with the Lodge program is really based on peer support, and so that has been something that we've been implementing since 2011. And we have sent a couple individuals through peer support training, peer support specialist training. And I do agree. I think that sometimes it is best to have somebody who's not necessarily always like a recovering
Right.
addict or
Right.
or an individual who's diagnosed with mental illness. But ultimately, I think one of the biggest things that that I kind of look for in a peer support specialist is somebody who does have that experience with homelessness.
Okay.
I think that's a unique quality and experience that unless you've experienced it, it's hard to relate to. And so that's I agree with the mental health and the substance part. Yeah.
Right.
Yeah.
And I think from CART's model, like that part, like, oh, it doesn't necessarily have to be someone who doesn't have lived experience, can work in a lot of programs, or like if people want to go out and just do individual coaching, like that can be beneficial in some scenarios. For your program, I agree. I think that it would be most beneficial if you could find advocates who have that lived experience. But yeah, I totally agree, because that does kind of bring in that whole like non-judgmental, like I'm just going to be there to support you because I get it, that whole thing. So yeah, I agree. In the case of Cross Park Place and implementing it here, that is super important.
Do you, so I'm just wondering, are you thinking that you would be the one? I know you said identifying a trainer.
I know.
Is that a goal of yours?
I was talking to Faraji about this yesterday, and I was like, "What am I gonna do when they're like, well, what if we do want to do this?" And I'll be like terrified to like do my first training. But he was like, "No, that's so cool," because I'm sticking around this summer. It'll be like my first summer in Iowa City, and he was just saying like that's what we were like trained to do though, and like we can like him and I can work together and do like partner and do one. But yeah,
you
just
guys
like
also have a network of other people too.
yeah, absolutely. And but yeah, so I mean I am certified and I would love to do something, but it's also
And are you guys presenting this to other agencies as well? I know you said you talked to Prelude. Or are you kind of formatting and kind of really targeting Cross Park and Shelter House at this point?
We aren't gonna talk to any other agencies at the moment, just time-wise. But we actually got the idea when we were doing some like initial kind of community assessment. We were kind of looking at the different agencies that are offered, or the different services offered by different agencies, and we noticed that Prelude has something similar, but it's like no.
yeah, and I think
no
like
zero tolerance on
yeah, and a lot of them are like that. Like I think
zero tolerance on drug use.
Yeah, and with Fair Weather Lodge, correct me if I'm wrong, but is it like you have to be sober to access? Like you have to be.
We ask for sobriety
Okay.
so that they can work on their mental health, but it's not zero
Like
tolerance.
ultimate, yeah.
Right.
Yeah.
So we got the vibe more from Prelude that, I mean, zero tolerance sounds harsh, but that's their mission. That's their thing. They don't want anyone even kind of doing baby steps. They kind of just want sobriety, which works for a lot of people, but we know just based off the evidence that we've looked that it doesn't work for everyone. So that's why we were really kind of attracted to this model and kind of how you guys navigate Fairweather Lodge as well. Like sobriety is highly recommended at the beginning, but not like zero tolerance. So I think that's why we were like, Cross Park Place seems cool. It seems like they get it in that sense. So yeah.
Do you have any questions?
Good job. It's got a lot of information.
Yeah.
So, peer recovery is something we've looked at for Cross Park just down the road when we have a little more
Right.
feet established on the ground here.
Totally.
Yeah.
How are things like going with you guys? I remember I was in I think it was one of the social work classes in last semester or last year. I don't know.
Social justice.
Social justice. Someone came.
Oh, I
yeah.
think
Did
it was
you come?
me. Yeah.
Yeah.
Yeah,
it's
I think
really cool.
things are. I mean,
Chugging
we're
along.
here. We're just like everybody else. We have our days. So, yeah.
Well, very cool. Thank you so much for
Thank you.
even just
thanks
giving
for
us
coming
20
in.
minutes to talk
Yeah.
about it. We greatly appreciate it.
Yeah.
But we'll let you guys keep those.
Yeah,
and
great.
then, I don't know. I mean, if down the future you guys did want to implement something,
We've got your,
you've got my
your
email.
name.
Yep. Yep. But yeah, thank you guys so much for
Well, good luck with the rest of your
Good information
semester.
to have.
Yeah.
Alright.
Thank you.
Thank you.